Hello, welcome to Nursing Guru. So in this first we'll discuss regarding anatomy and physiology. So in the musculoskeletal system we have bones, muscles, ligaments, tendons, cartilages along with the joints. Totally we have 206 bones in our body. Next let's discuss regarding the functions. It supports our body, it gives protection to the internal organs, it supports, then it stores the minerals, fats, then it distributes the fats and minerals whenever it is needed. So this is the main function of the musculoskeletal system. Next, nursing assessment. First, we need to take the history. What and all history you will take regarding any pain, any swelling, anything, you will take the history of the things. Next, physical assessment. You will assess the things which is related to posture, gait, how the patient is walking, whether the posture is proper or not, whether any problems are there, everything you will collect the history. Next, diagnostic tests. You will do arthrocentesis, then arthroscopy, you will do the blood test, then x-ray, what and all necessary to check related to muscles and bones, all the tests you will do. And also along with that we can go for CBC, that is complete blood count. For 15 days to 1 month, then it is removed so that the articulation comes back again, so that it fits back the joint. So how to manage this dislocation? Mainly the patient complains regarding the pain and immobility. So for pain, pharmacological management, you can give painkillers, for example diclofenac sodium, then paracetamol, like these drugs you can give, and along with that you can give H2 receptor blockers to control acidity due to the painkillers. Next, you need to provide the comfort to the patient, and you need to assist the patient so that the patient can perform daily living activities, because the patient will be immobilized due to the dislocation of the joint. Any kind of dislocation, it may be in the hand or it may be in the leg, so you need to assist the patient for the daily activities. Next, let's move towards fracture. It's a breakage of continuity in the bone. So when the bone is broken due to any kind of reasons, it is called fracture. We have many types. Next, let's move towards the management. How to manage this fracture? Same what we discussed earlier, like dislocation, same like that only we are going to manage the fracture also. We will put the cast around that and we will leave it for 15 days to 1 month so that the bones get attached, then later we will remove the cast. So here along with that, same like the nursing management, same like dislocation, what you will do, you will give the support to the patient. So you need to help the patient to do daily living activities. Next, let's discuss regarding sprain. So sprain is a ligament injury. Ligament is surrounding to the joint. So here ligament will get tear due to maybe fall or any trauma. So here how we will manage? Here we will use the crepe bandages and we will immobilize the part for some days. So it is according to the injury. If the injury is less, it can be treated within 7 days. If the injury is more, we need to treat it for 15 days and up to a month. And here the nursing management will be same as dislocation and fracture. Here we need to assist the patient for daily living activities, and the patient should do range of motion exercises, just like moving left or right by in the sitting position. We need not do so many exercises and the patient is advised to take rest. Next, let's discuss regarding strain. Strain is a muscle pull. So here by overusing the muscle it may be caused. So suddenly we will experience a pull or we will experience a pain, that is called strains. Here we need to take some rest to relieve the pain, and we can go for analgesics to reduce the pain. And nursing management will be same. We need to provide the rest and just range of motion exercises every day. Then we need to help the patient to do daily living activities. Next, concussions. Concussion is a soft tissue injury due to the blunt force. When any blunt object hits the soft tissue, here we will get the concussions. Here the patient may experience pain, swelling or redness above the skin, but there will be no bleeding outside. So in internal hemorrhage will be there, swelling will be there, and tenderness will be there. When the part is touched, the patient will experience the pain. Next, we'll move to amputation. Amputation is where the part has been cut due to any trauma or accident. So here what we need to do immediately, we need to stop the bleeding by giving the first aid. Then the patient should be sent to surgery so that the part should be amputated and should be covered with the skin from skin graft. Next, let's move towards the nursing management of musculoskeletal problems. So what and all we need to do? First one, cast. So what is cast? We call it as POP. So nowadays we use white cement and we will put the cast for that particular fractured part. So what is the use of this? The main function is to immobilize the part. So if we immobilize the part, so it will heal very fastly. Second one is splints. Splints also we use to immobilize the part, but here we can remove the splints whenever it is needed, but POP cannot be removed. POP can be removed only after finishing the treatment, like after 15 days or 30 days, but here splint can be removed whenever you need it. For example, while taking bath or while sleeping, you can remove the splint. Third one is traction. So here traction means we are applying the weight on the part of the body. We will use the pulling force. So how we will use this? We will use some sandbags or we will use some weights and we will pull the body part to come to make it a correct position. So for example, the fracture has been occurred and the bones has been dislocated. We will pull that by putting the sandbag or some weight and we will make them to come together. That is traction. Next, fourth one is crutch walking. So you can use the crutches to walk so that the patient feel comfortable while walking. Here when the patient has very less injury, he does not need any cast or anything, we will assist him to walk by the crutches. So here so many different kinds of crutches are there. We can use two crutches. So sometimes we have single crutch which has the four legs. We can use this. Sometimes like a quad cane we can use which looks like a single stick. We have many different kinds of crutches. Next, let's move towards the bone infections. First one is osteomyelitis. Osteomyelitis is an infection of the bone. So here bone tissue will be gets infected by Staphylococcus aureus. The signs and symptoms of osteomyelitis is high fever, chills and pain in the area, tenderness, redness. These all symptoms we will see in the osteomyelitis patient. How to manage this? Medical management. So for medical management we need to do the antibiotic therapy along with the analgesics to reduce the pain, and nursing management will be assist the patient so that he can perform daily living activities and provide comfortable positions and comfort devices. So next, benign and malignant tumors. In benign tumors, you may see some tumors in the bone joints or the long bones, especially like a femur, humerus. Here we can treat the tumors because it is benign. So if it is malignant, it will be spread to the various parts of the body, like sometimes it will be there in the vertebrae and long bones, sometimes it will be there in the small bones also like phalanges and all. So it is called multiple myeloma. So the malignant tumors, it is also called multiple myeloma because it has been spread to the multiple parts of the body. So how you can treat them? So the first thing is chemotherapy, the medical management. Then what is the nursing management? Nursing management, you need to provide the comfortable position to the patient. Then as usually analgesics, if the pain is less, you can give the analgesics which are manageable like diclofenac sodium. If it is not manageable, you can give tramadol. Inflammation of the bursa is called bursitis. How it is caused? The main etiology is due to the infections. In the obesity patient and hypertensive patient, when the immunity is very low, it is caused due to the any other infections. Symptoms will be pain, redness, tenderness, especially we will see in the joints like shoulder, knee, then elbow. In all these joints we can see this bursitis. The main medical management is antibiotic therapy and analgesics to reduce the pain. If it is not reduced after giving antibiotic therapy, you can continue to give corticosteroids. And nursing management, the main thing is rest, and you can give ice compressions to reduce the pain and discomfort in the joints. Second one is synovitis. Synovitis is inflammation in the synovial joints. So where the joints are infected, so here the patient will feel severe pain while moving the joints. It is also caused by any infections and where the patient has very less immunity. So here the signs and symptoms will be pain, tenderness, redness, as you seen in the bursitis. Same signs and symptoms we can see in the synovitis. The management also will be same. We will give antibiotic therapy and analgesics. If it is not reduced and if the patient has continuous history of this synovitis, then we will give corticosteroids to reduce the inflammation. Then nursing management, we will provide comfortable position and we will provide the help so that he can do his daily activities. Next, third one is arthritis. Arthritis is the inflammation of one or more bones. So here sometimes only one bone joint will be affected, sometimes there will be more bone joints will be affected. In the early stage we can see one or two joints will be affected. Later on it will keep on spreading. So the main cause, what is the cause here? So immunity dysfunction is the main cause. Sometimes it is genetic. If your parents or any other ancestors, if they have, you may carry that. Then second main etiology is infection. It will cause due to any other infections. Next, the signs and symptoms. Here severe joint pain will be there. The patient will complain that he cannot able to move and he is experiencing severe pain while moving or while doing any other work. And here the tenderness, swelling also you can see in the joints. Next, how to diagnose this? You can do the ultrasound, you can do MRI of the joints, then X-ray. In the X-ray only you will see the little swelling, but in the MRI you can see the detailed things. Next, treatment for arthritis. So here we can do the replacement of the joints, especially the patient will have the pain in the knees. Most of the patients we can see that they will complain regarding the pain in the knees, so we can replace the kneecap by doing the surgeries. Then you can give antibiotics and analgesics to reduce the inflammation and to reduce the pain. Then nursing management will be same like other disorders of the musculoskeletal system. We need to provide the rest to the patient, and as well as we need to provide the comfortable position and comfort devices, and we need to assist them in daily living activities. Next, let's discuss regarding the special therapies. Here we will see two things. First thing is physiotherapy. Physiotherapy we need so that the patient can mobilize properly. So here we will assist the patient and we will make him to mobilize when he have any disorders, when he comes to the rehabilitation stage. Second one is supplement. So here what kind of supplements we can give? We can give the calcium supplements because it is very necessary to the bone tissues. So these things we will do in the special therapies. Next, alternative therapies. In alternative therapies we can give acupuncture, aromatherapy. So here acupuncture will be given so that the patient relieve from the pain. So this is one kind of alternative therapy. And also aromatherapy. In aromatherapy we will give some medicine so that the aroma will enter, so that the patient will feel relief from the pain because he is distracted by the aroma. This is called aromatherapy. Next, we will discuss regarding metabolic bone disorders. First one is osteoporosis. Here in the osteoporosis there will be very low bone density due to the destruction of bone tissues. Here the patient's bone density will be very less, and here the patient will experience severe pain. He cannot do anything, his weight will be very less, the bones will be not strong, and if he perform any activity immediately the bone will break due to the low density of the bone. Causes will be unknown for this disorder. Here we do not have any causes for this. It is idiopathic. Then diagnostic evaluation you can go for ultrasonography, MRI and X-ray. Then the treatment you can do hormone replacement therapy. So here estrogen will be given so that the hormone will be replaced to treat the disorder. Next, second one is osteomalacia. Osteomalacia is a softening of the bones due to inadequate phosphate and calcium. So here mainly we can see this disorder when the patient has very less calcium and phosphate in his body. The symptom will be same like osteoporosis. So here the patient will feel extreme pain, he cannot do any activities. If he perform activities, he can see the breakage of the bone or fracture, he may complain severe pain. So here the management also will be same. You can give him some calcium, then you can provide analgesics to reduce the pain, and you can provide the rest and comfortable position and provide comfort devices, and you can assist him to the daily living activities. Next, Paget's disease. Paget's disease, it is a chronic condition of the bone where we can see the excessive breakage of the bone's tissue. So here continuously excessive breakage will be there in the bone's tissue, and again when reforming the bone tissue, here it will form like abnormally. So due to this the normal structure will be deformed. This is called Paget's disease. The etiology will be unknown. It is caused by a virus called paramyxovirus. Next, symptoms of Paget's disease. Here continuously the patient will experience fractures. Then here he will complain regarding the severe pain. Next, diagnostic evaluations. Here ultrasonography is done, X-ray is done and MRI will be done to find out the Paget's disease. Next, let's see regarding the spinal cord defects and deformities. First one is spinal cord tumor. Spinal cord tumor is a mass of tissue in spinal cord. Sometimes it may be within the spinal cord or sometimes it will be around the spinal cord. So here etiology sometimes maybe it is due to the genetics or sometimes maybe it is due to the metastasis from the different site. So how to diagnose this? To diagnose this, MRI should be taken or PET CT should be done. The management will be medical management as we have seen. So same like other tumors, we will give chemotherapy drugs, and nursing management also will be same like other tumors. We need to give rest to the patient and we need to help him to do the daily living activities. Next, prolapsed intervertebral disc. Here we can see the herniation in the vertebral disc. It may be in the lumbar or it may be in the thoracic. Usually it can be seen in the lumbar, especially when the patient is aged after 40 or 50 years. Here the disc will be degenerated and sometimes it will be bulgy. This is called herniation of the disc. So here the etiology will be due to the occupational stress. So whatever daily activities, work, if the excessive work will be done, it will be degenerated due to the friction, everyday movement. So this is the main etiology and it is seen usually in adults like 50-year-old and in the elderly patients like after 60, 70 age. The management will be, we can give analgesics to reduce the pain and we can provide rest. We can tell them to reduce the activities so that the disc degeneration will be stopped. Next, pot spine. Pot spine is also called tuberculosis of the spine. So here the tuberculosis from the lungs, it will be spread to the spine and we can see the degeneration in the spine. So here the main cause is Mycobacterium tuberculosis. As you know, it is the agent of the tuberculosis. This virus will be spread to the spine and due to this the lesions can be seen in the spine. Here the symptoms, already the patient will be having the tuberculosis symptoms in the lungs like cough, fever, chills, sputum, all these things, and along with that the patient will have weakness, weight loss and severe pain in the spinal region. For example, he will experience back pain, lumbar pain, all these kinds of symptoms. So how to diagnose this? To check, blood test first for the Mycobacterium tuberculosis, then sputum test, and to find out pot spine we need to do the MRI of the spine to recognize any lesions. Next, management. Medical management, same it will be like to manage the tuberculosis. We can give the drugs like rifampicin and all. Then to relieve the pain we will give the painkillers. So as usually we will give diclofenac sodium then along with the DOTS therapy. So if the patient has severe pain we will go for tramadol. Then nursing management, rest, and along with that what we will do, we will give some more therapies, especially like cup therapy to remove the sputum from patient lungs. Then coughing and breathing exercises. Next we will discuss regarding rehabilitation and prosthetics. So here prosthesis we use for amputated leg or any other limb. For example, it is an artificial limb which is made of resin or foam or any other material. So here we have two types, endoskeletal and exoskeletal. So first one is exoskeletal. Exoskeletal, it is made of resin and inner filler material will be wood or foam and it will be very strong and durable compared to endoskeletal. Endoskeletal, here outer foam sheet will be there and inside the metal stick will be there and it will not give that much comfort to the patient, and it is not durable compared to exoskeletal. Next one is total replacement therapies. So in this first one is total replacement of an entire joint. So here the entire damaged joint will be replaced with the artificial material called ceramic or any other material or plastic. We can use also metals here. So here the surgeries will be done, the damaged part will be removed and it is replaced by prosthesis. So far we discussed regarding the musculoskeletal problems and its management. If you have any doubts, please comment below and like and subscribe to our channel. Thank you.